Hello everyone, I am Kayuri, a third year physiotherapy student, and my topic is elbow muscle testing MMT for the physical and functional diagnosis. First of all, what is MMT? It is a standardized clinical method to assess muscle strength, detect weakness, and nerve injury. Its gradings are 0 to 5, from no contraction to full strength against maximal resistance. Its clinical purpose is guides diagnosis, treatment and planning, and rehabilitation progress monitoring. Objectives are assess elbow flexors, extensors, and forearm supinator and pronators. Its grading system is the MMT scale 0 to 5 quantifies muscle strength. So grades 5 to 3 assess functional against gravity and resistance, forming the clinical benchmark for upper limb muscles performance evaluation. So grade 5 will be normal, grade 4 will be good, grade 3 will be fair, grade 2 will be poor, and grade 1 will only do like a flicker contraction, and grade 0 will be zero contraction. Now starting with elbow flexion, its range of motion normally will be 0 to 150 degree. Its prime movers will be brachialis, biceps brachii and brachioradialis. Then accessory muscles will be pronator teres, extensor carpi radialis longus, flexor carpi radialis and flexor carpi ulnaris. Its function is mainly brings the forearm towards the arm through the arc of elbow flexion. Now the procedure. Patient position will be short, sitting, arms at side. As you can see in the picture, therapist position will be stand in front on test side. One hand resist volar forearm prominent to wrist. Other hand stabilizes anterior shoulder. Movement will be flexion. Patient flexes elbow through the full ROM. Now it's grades. So we'll do grade 3 first. We'll tell patient to bend your elbow. Then grade 5 and 4 will be bend your elbow and hold it, don't let me pull it down. So we will apply minimal resistance in 4th grade and 5th in maximum resistance. Grade 3 will be normal without resistance in against the gravity. And grade 1 will be palpable contraction in biceps, brachialis and brachioradialis that we will palpate in the patient, and grade 0 will be no contraction at all. This is the me performing on the patient. This is grade 3. This is grade 4. This is grade 5. This is grade 2. We will hold the patient from the elbow. This is grade 0. Sorry, 1. We will palpate the muscle, and grade 0 will be no contraction at all. We will not able to see it or feel it. Then next, elbow extension. Elbow extension involves straightening the elbow joint through a range of motion from 150 to -5. The normal it is. The prime movers will be triceps brachii, comprising the long and lateral and medial heads working in concert to extend the forearm. Procedures will be, the gradings will be the same as the flexion ones. Patient will be short sitting, shoulder flexed at 90, elbow flexed. This is the procedure. This is grade 3. Patient will do the against gravity, and this is grade 4, the minimal resistance, and this is grade 5. This is grade 2, the against gravity eliminated, and this is the me palpating the muscle, grade 1, and the grade 0 will be flicker contraction. Then forearm and supination. Range of motion will be 0 to 80 degree. Prime movers will be biceps brachii and supinator, long and short heads. Then function will be turns palm upward or anteriorly, supination movement. The gradings will be the same. Patient will be seated, elbow flexed to 90, forearm in neutral. Therapist stabilizes the elbow and raises the distal forearm. Instruction will be turn your palm up, hold it, don't let me turn it down. Keep wrist and fingers relaxed. You can see in the pictures as well. And this is how we will do. We'll start with grade 3, then grade 4, 5, 2, 0, 2, 1 and 0. Then forearms pronation. Its anatomy and function. Range of motion will be 0 to 80. As the pronation 1, prime movers will be pronator teres, humeral and ulnar heads, and pronator quadratus. Accessory muscles will be flexor carpi radialis. Function is turns the palm downward posteriorly, rotating the forearm into prone position. So it is literally the opposite of supination. So the gradings will be the same, and we'll have to do the movement opposite of the supination, and we'll give the resistance in the same grades as we did in supination as well, and the positions will be the same as supination. Now its clinical significance of elbow MMT. Why we do it, why we need to do it, or why we need to check the strength of muscle. So first, to test muscle weakness detection. For the diagnosis or the purpose of when we need to know the assessment, the improvement. So it identifies the qualifies muscle weakness and peripheral nerve injuries. Then fracture and rehab monitoring. While the rehab, we need to monitor how the improvement has happened and the evaluation notice. Example, post fracture recovery, it tracks rehabilitation progress. For the treatment planning and diagnosis, it guides targeted physiotherapy intervention and clinical decision making. And functional performance measures upper limb functional capacity for daily activities. Precautions we need to take while performing or testing on the patient. Proper precautions ensure patient safety, accurate results, and clinical reliability during elbow manual muscle testing. Always follow standardized protocols to avoid errors and patient discomfort. So first we need to explain and compare both the limbs. We need to explain patient that what we're going to do, how we're going to do, and how we're going to do that on the patient. Patient should be relaxed and comfortable. Patient should be knowing that they need to move their movement. We need to prevent the compensation movement as well. When patient does that due to pain or any other movement, patient may do compensatory movement, and we need to mind that to avoid it for the best results. Then monitor comfort and resistance. We need to give the resistance as the needed, and we need to monitor the patient is comfortable throughout the movement. Thank you. And the reference is Daniels and Worthlingham's muscle testing book.